Hello and welcome to this special show on Rajya Sabha Television. I am Vishal Dahiya, and here we take a stock of India's fight against COVID-19, various aspects of it. How does this particular virus affect human body? What is being done in terms of battling this particular pandemic, in terms of drugs, vaccines, and several other related aspects as well. So today we're going to talk about its effects on a particular part of human body, that is the endocrine system. Now, how does COVID-19 affect the endocrine system in the human body? And for more on this, we're joined by a distinguished panel of guests. Let me first introduce them to you, beginning with Dr. Sanjay Kumar Bhadada. He is the professor of endocrinology at PGIMER, Chandigarh. We also have with us Dr. Saptarshi Bhattacharya. He is a senior consultant and head of the Department of Endocrinology at MEX Superspeciality Hospital. And we also have with us Dr. Puneet Misra, the professor from Center for Community Medicine at AIIMS in New Delhi. Welcome all of you gentlemen to Rajya Sabha TV. Let me begin with you, Dr. Bhadada, since you published a paper on this as well. Let's try and understand the correlation between COVID-19 and the endocrine system.
Okay. So basically COVID-19 can affect any system, and the endocrine system is one of them, of course. And recent news is there, or the information is there, the maximum mortality has been documented in 3 disorders. That is, one is hypertension, second is diabetes, and third is obesity, in addition to other comorbidities also. And fortunately or unfortunately, these three domains are actually dealt by the endocrinologists all over the world. And then the maximum mortality with these disorders are there. So the mechanism put forward is that why these people are having more mortality as compared to other people. So a simplest mechanism for the layman language is that the immunity in these disorders is much less as compared to the normal human being. So when there is a diabetes, hyperglycemia, and that immunity is less, when the immunity is less, there is more chances of the mortality in these disorders. So diabetes is one of them. Then of course vitamin D is coming in big way, and that says that vitamin D deficiency also can predispose for the more mortality. Though data is not very robust, but the information available with relation to geography, with relation to available vitamin D levels, and with relation to outcome is suggests that if vitamin D deficiency is there, the mortality will be more. Well, in addition to the various other endocrine disorders are also affected, but may not be that important as the diabetes, obesity, and the vitamin D is there.
So, Dr. Bhadada, and how does it, react inside the body? Because the study also talk about some ACE2 protein.
Okay. So the ACE2 receptors are there. Those are present in the pneumocytes of the lung. So ACE2 receptors are actually more active in patients of type 2 diabetes. So that actually predisposes that ACE2 receptor is required for the entry of this virus into the body. Mm-hmm. So when these ACE2 receptors are more in the on the pneumocytes, and in case of diabetes they are overexpressed, then there is a more possibility of entering this virus into the pneumocytes. And the more entry of the virus is there, more the serious disease is there.
Okay. Okay, let me bring in Dr. Saptarshi here. Dr. Saptarshi, your views on this, and also the fact that, the study also mentions some of the studies that the post-COVID fatigue syndrome is also one of the aspects of how, COVID-19 or coronavirus affects the endocrine system.
So I think there are 2 issues. So one, people who are already having some endocrine disorders like diabetes, obesity, hypertension, and other cardiovascular comorbidities, as Dr. Bhadada told, they are more predisposed to infection and also severe infection. Also the outcomes like increased requirement for ventilator or increased ICU stay or even increased mortality has also been seen in this group of patients. Mm-hmm. Also, we need to look into how COVID-19 actually affects the various glands. So endocrinology for the layman, so many people might not be knowing what endocrinology is. So it deals with the science of different glands in the body, the glands which mostly secrete hormones. So these are the glands which come under the cover of endocrinology. So it can be pancreas which secretes insulin, it can be thyroid which secretes the thyroid hormones, it can be the pituitary which is called the master endocrine gland, and there are important other glands like adrenal gland and the ovary and the testes. So this infection has been shown to affect almost all the glands. There is not a direct correlation, we don't have very direct proof. So we have some proof that in this infection can affect the thyroid gland and cause thyroiditis. So there are case reports which are coming up about affection of the thyroid gland and the gland getting damaged and the hormone secretion of the gland getting disturbed. So that is one mechanism. The earlier SARS-CoV-1 infection, which was there in 2003, so there were reports that that virus affected the adrenal gland as well. As of now, we have not come across any major reports which have shown that adrenal gland has been affected by the current strains of SARS-CoV-2 or the COVID-19 infection which we are having right now. So that is a good thing, but maybe there are so many unanswered things about this virus, so it's still in an evolving phase. Our knowledge is also in an evolving phase. So how these glands affect each of the individual glands, we will get more answers as we get to know more and more about this infection. But obviously affection of the endocrine glands can be a mechanism behind the fatigue syndrome which has been shown to occur after the COVID-19 infection, even after 10 days, 15 days or 20 days of recovery. We have patients who are coming back and are telling we are having extreme fatigue even though their infection has settled down. I had a diabetic patient last day who said my sugar levels are normal, everything is normal, but I am very, very fatigued. So most probably we'll have a definite mechanism as to how this is happening in the coming days.
Okay, so we'll learn along the way. But in terms of symptoms, Dr. Saptarshi, what are the symptoms one should look forward to when we talk about this particular virus affecting the endocrine system or various glands?
So first of all, there are if somebody is having diabetes or underlying comorbidities, that person needs to be very, very careful. If there is any symptom related to COVID-19 which of exacerbation, like somebody is having shortness of breath, or if many people have a pulse oximeter nowadays at home, if the saturation is going down, so that person needs to immediately get in touch with the healthcare professionals, maybe get admitted. So we need to have a lower threshold for admission for patients who have underlying endocrine disorders. Regarding the manifestations of endocrine affection, so thyroiditis, usually it affects as pain in the thyroid. Along with, there can be symptoms of excess thyroid hormone secretion. The symptoms of excess thyroid hormone secretion are there can be palpitation, there can be some weight loss, there can be tremors, there can be frequency of bowel movement. So these are the usual symptoms of excess thyroid hormone. So it may or may not be accompanied by pain over the neck, which is usually a feature of a variant of thyroiditis, which is known as subacute thyroiditis. If the pain in the neck might remain silent also, then we call it silent thyroiditis. Adrenal gland symptoms are usually not relevant in the current situation, so I'm not going to go into that, because as of now we don't have any reports of adrenal insufficiency due to COVID-19. But there are some cases of case reports which are also coming up that COVID-19 can unmask diabetes in many of our patients. So we have patients who has come to the endocrinologist with a blood sugar of 200 or 300 or 400, and we certainly see that some very mild symptoms of COVID, maybe, or no symptoms, and for some reason a COVID-19 test is done and that test comes out to be positive. So there have been patients who have been otherwise asymptomatic. Again, small case report, that is not the usual trend. The usual trend will be a flu-like symptom with a more severity and higher chance of fatality. So that will be the usual manifestation. I am not going to confuse the audience by telling that these are the typical symptoms. So these are unusual symptoms, but these symptoms do keep on coming up. And there are cases of diabetic ketoacidosis, which is a very severe form of diabetes, where there is accumulation of ketone bodies in the blood. The patient gets more breathless, there is abdominal pain, there is vomiting. So that can be another unusual manifestation in patients with pre-existing diabetes or onset of de novo diabetes also.
Okay. So these are certain factors which will have to be looked into. Let me bring in Dr. Misra now here, Dr. Puneet Misra from AIIMS. Dr. Misra, your views on this correlation between COVID-19 and endocrine system, and also you must have also encountered these kind of symptoms in the patients as the other panelists are pointing out.
Yes, what I would like to speak here, taking your questions about what is the public health importance and how the epidemiologists see these issues. The thing is, as my co-panelists they have pointed out, and we know from different studies that people who are suffering from certain endocrine disorders like diabetes or having obesity or hypertension, they are having excess mortality. I mean, they have a higher mortality as compared to normal population. That is one point. The other thing is, which is worrying, especially in context of India, that in India, very often we say that this is a diabetic capital of the world. Next point is that in India, the diabetics, if you compare from the Western countries, here we develop diabetes at least 1 decade earlier as compared to the Western countries. I mean, more and more younger people they get diabetes if you compare UK, US, or any Western country, right? So we are almost 1.4 billion population. We are diabetic capital of the world. We have younger people who are having diabetes. So as it from the public health point of view, what I see that the if we do not take appropriate care for these people, there will be higher mortality because and when we say that the risk is more in people who are 65 plus, that holds true for Western countries. But in our country, from the public health point of view, or what I'll say, we should say at least 1 decade earlier, that is 55 or 50 plus, having the comorbidities, we should take that special care. The other issue which is important here, because of the COVID situation, many of the patients they are not getting the regular services which they are supposed to do. But especially in case of diabetes, it is very important that they go for the regular checkup so that their blood sugar and other parameters they remain in control. If they are not in control, I mean their excess mortality not because of the COVID but because of diabetes per se. So this is the population which is quite vulnerable in our country. This population is very high because of increased prevalence and because of our population and younger age. The other thing which our co-panelist has pointed out about the vitamin D deficiency, that is also very important, in Indian context. Previously, we were thinking that since we are getting enough sunlight, so we don't have this problem. But the studies done by many of authors in India, even I have done a study in the rural area. So what we have seen that a large chunk of our population they are either vitamin D insufficient or deficient. So I mean that population is also having at the higher risk. I mean that we have the preliminary data. We are not very sure about that, but yes, there is data. And when there was a prolonged lockdown, I mean, even the month of March, and the lot of people, even they were not exposed to sun, which is usually gives us little, I mean, better vitamin D reserve. So that is another scope from public health point of view. I think here comes the role of government and public health professional along with the endocrinologists who are mainly responsible for treating these disorders. That we should take care of this population which is vulnerable, which is young population, and they should be treated in the way that their sugar level, their other parameters, they remain in control. So even if they develop COVID, corona infection, the mortality, we can reduce the mortality, which is our ultimate aim.
Okay. Dr. Bhadada, I'd like to bring you on that point from the public health, perspective. What Dr. Misra is saying, that we know that there are underlying conditions as far as diabetes and vitamin D deficiency is concerned in a significant portion of our population. So obviously, protective steps needs to be taken. One on that aspect, and two, if somebody with the underlying conditions, some of these underlying conditions does contract COVID-19, is tested positive for this particular disease, what is the clinical line of treatment in terms of ensuring that lesser damage is done?
Yeah. So I think very important question. And first I'll take the vitamin D. So this is not correct that vitamin D deficiency is there, so you are going to get more infection. It may not be correct. But if you get the infection and if your vitamin D level is low, you are likely to have more severe disease. And that is because we know vitamin D is one of the vitamin that is responsible for the immunomodulation. And it has been known that vitamin D produces various antimicrobial peptides, and that's why it protects from the various infections including the virus. And the second, if the patient developed the infection, it is known to immunomodulate, and that's why there is less chances of having the cytokine storm. The cytokine storm is one of the terminology very frequently used, and that is actually the responsible for the more mortality in patients suffering from the COVID-19. So by treating with vitamin D or making an individual vitamin D sufficient, that will prevent from the severe complications related to COVID-19. Though very small studies are there, those are telling that if patient is vitamin D sufficient, there will be less hospital stay, less ICU stay, and less time for the ventilator. So that's why vitamin D supplementation is recommended. Now the questions come is that what should be the vitamin D level? So generally, we don't recommend vitamin D level for each and every individuals, but for the COVID-19 patient, it is recommended and we should get it done. If the patient is deficient, that should be supplemented. The protocol for supplementation is like, it is quite variable, but patient those are deficient, that can be given the oral vitamin D in form of 60,000 units per day for 6 to 8 days to rapidly increase the vitamin D level. Though in the standard protocol, it is given once a week for 8 weeks, then once a month. But individuals, those are suffering from COVID-19 and having severe vitamin D deficiency, that can be given on the daily basis, and vitamin D level can be achieved to 30 to 40 nanogram per ml.
Okay.
So that is about vitamin D. Now coming to the type 2 diabetes or the type 1 diabetes. We actually did the 2 studies in which we studied the type 1 diabetes individual through the phone call. And we collected their information, what kind of problems they are facing, that the insulin is available or not, their glucose strips are available or not, they are able to control the blood glucose and all these things. In addition to that worry, because every time they are watching TV and there is that risk that patients suffering from type 2 diabetes or type 1 diabetes are more risk. So that is one of the factors. So by talking them for this kind of situation, patient should be in consult with their doctors. Maybe whatever means, not physically, but in form of telecommunication, in form of telephone, in form of video call, in form of Skype, in form of chat. And we have various, our endocrine faculty through Endocrine Society of India, they are conducted various studies and the kind of online programs for the type 1 diabetes individuals. So that can be done. Second, related to type 2 diabetes, as Dr. Misra and Dr. Saptarshi told, that diabetes control is very essential. So aim is to control diabetes. Now problem is that in the lockdown period, people cannot go outside because of this lockdown. But I know, and this is my personal experience, that if people decide they can do at home itself 10,000 steps every day, even in a flat. So the target, they should be very clear about that. They have to do the exercise. Whatever means, if they are in the flat or they are in the house or something, they should do regular exercise. Control their diet adequately, because I learned that many people are making lot of sweets at home in this during period lockdown. They are eating because nothing to do. So they should take care of their diet. That is another very important thing. Third thing is, whatever oral drugs they are taking, they should not stop any kind of oral drug. All are safe. The first aim is to control the blood glucose. Second aim is, any drug can cause any harm or not. So that is not yet proven. So whatever the medication they are taking, it should be continued, and the target to achieve the blood glucose.
Okay.
And as well as, if the patient are taking insulin, they should continue with their insulin. Insulin is the most safe drug in any condition. So similarly with in this era also, that is also equally important. So aim is to control their blood glucose by diet, by exercise, by oral drugs, by insulin, and check their blood glucose regularly with the glucometer. And they can consult their doctor on the telephone or on the video or on the WhatsApp, sending their reports, is that okay or not. One more thing about vitamin D I want to tell is why it is important is that otherwise we are less exposed to the sunlight. Now in the lockdown we are at home, and on the top of we are coming out, we are putting a mask on the face. So body should be exposed to sunlight, and this by putting a mask that will another cover almost 5% of your face. That is the main site where vitamin D synthesis takes place. So that is further increases the possibility of vitamin D deficiency. So vitamin D supplementation is probably a very important aspect on this.
Okay, Dr. Saptarshi, your views on that in terms of, would you like to add something, the way clinically this entire process has to be looked at? Obviously, several steps are being suggested by Dr. Bhadada out there. Go ahead and tell those people specifically with pre-existing conditions as to what can be done at home in case they do contract the virus. The clinical, treatment way. How do you go ahead and deal with that?
See, it's very important what Dr. Bhadada told. I totally agree with it, that vitamin D we usually tend to supplement in most of the Indian subjects because the prevalence of vitamin D deficiency in India is very high. And in this setting, and with so many other risk factors of having more vitamin D deficiency, it's very important to supplement vitamin D. Okay. So on top of that, I would like to emphasize on one point that if somebody is having some pre-existing disease and is on certain amount of medication for that, so there are lots of confusing news which are going on in the social media that okay, this medication can increase it, this medication can decrease it. So I totally agree with Dr. Bhadada. So there has been multiple guidelines from international guidelines, national guidelines from India. ICMR has also told. So none of the current medications have any proven negative effect on COVID-19 severity or chances of having more COVID-19. So that has not been proven with any of the medication. So please, if you are on a certain amount of medication and your blood pressure, your glycemic control, your lipid parameters are all in the normal range, please do continue it. If you are able to get in touch with your doctor through telemedicine, please do that. If you are not able to get in touch with your doctor, you are able to get your tests repeated somewhere and you see that the reports are normal, please do continue the same medication the way you are doing. But if somebody acquires the infection, then obviously these are the subgroups which are more predisposed to severe infection, more so if the parameters are uncontrolled. So I totally agree with Dr. Bhadada that if a it has not been proven till now that a diabetic as such is more predisposed to infection. But okay, if a person with diabetes gets infection, and if more so if the infection glycemic control is not at par, then chances of severe infection is going to be more. So okay, it's very important. There is a huge, in studies we see that there are multiple studies from India and also the world, all over the world, that only 1/3 of the diabetic patients have HbA1c below 7, which is the standard recommended target. Actually 2/3 of the diabetic patients have HbA1c, which is the 3 months average blood glucose report, and that is the way to assess your overall glycemic status. So that HbA1c is usually more than 7 in at least 60 to 70% of the Indian population as well as the population world over. So okay, this is the most important time in this setting of COVID-19 pandemic, to control the blood sugar levels, to control blood pressure, to control your lipid parameters, because these are comorbidities which is going to increase the severity of infection. It's very important to do that. So if your glycemic control, blood pressure, lipids are all normal, please do continue the same. Keep in touch with your doctor periodically. If it's not controlled, please do immediately get in touch with your doctor and get it controlled as soon as possible. It's very important that okay, the comorbidities should be under control in the current pandemic situation.
Okay, let's a final concluding comments from Dr. Misra here in terms of your suggestions to the general public, Dr. Misra. What needs to be done here at this point in time, specifically for those with underlying conditions?
Yeah, thank you for asking this important question. My co-panelists, both the co-panelists, they have described it very well about what they need to do. But here I would like to summarize that since these people, they are at higher risk of, complications if they get the COVID. So it is very important for them to prevent this disease. And how can they reduce the risk for going to severe disease if at all they get the COVID infection? The first thing is, as Dr. Saptarshi and my co-panelists from PGI, they have pointed out, keep your values. I mean, if you're diabetic, keep your sugar in the normal range. Get yourself, checked on regular basis through your consulting physician, whether the endocrinologist, general physician, or whomsoever it is. Keep your lab values within normal range. And very important thing is that even if you are under lockdown, you can do certain exercises which will increase, physical activities always help. I mean, you can do some steps which can be done at the home. And the other important, it is a lockdown, doesn't mean you should expose yourself if you are at high risk to the food which is unhealthy for you, especially the sweets, especially the oily food. They all are, will increase your risk. So it is very important you take all your medications, do physical activity, take appropriate diet, get yourself checked to the doctor, and you have to take all the precautions more carefully which other people they are taking, like wearing the mask, which will protect you from getting infections, frequent hand washing, cough etiquette, and more importantly, don't roam outside if it is not really important.
Okay.
You can go for the walk to a nearby park if you are maintaining distance. That is safe. If it is, otherwise you should not move out unnecessarily. That is my message to the general masses, that if you have this disease, there's nothing to worry, but you should be more careful. If you will be careful, it will be all right.
Okay. Thank you so much Dr. Misra, Dr. Saptarshi, as well as Dr. Bhadada, who's with us and who's done a lot of work on this particular aspect. So there it is for our viewers in terms of what is the correlation between COVID-19 and endocrinology or endocrine system of the human body. As our panelists are pointing out, obviously, if you have pre-existing conditions, that does not lead to a COVID-19 infection, but if you get a COVID-19 infection, then somebody who has pre-existing conditions might be a little in a difficult situation with more complexity. So the idea here is to keep yourself healthy, keep yourself safe, and keep consulting your doctors or health professionals whom you are in touch with. That's all we have in this particular episode of India Fights Back on the COVID-19 special. We'll come back again tomorrow with a different topic. But till then, you keep watching Rajya Sabha television. Also, please do not forget to wear a face mask when you step out of your houses. Thank you.